I am Dr. Nancy Brandt. I'm a veterinarian, and then went back and got certified in many modalities. Founded the Veterinary Medical Aromatherapy Association and wrote the only course that actually is race approved for CEUs for veterinarians and vet techs. So in aromatherapy. So just always trying to give the education, but also get, because I'm in my last 2 quarters of my Oriental Medical Doctor degree. So I now treat people and I treat pets. So when I was asked to speak again, because I am in that program, and that program is intense and crazy, and I really don't know why I did it. I'm 60 years old. I teach for the school for 11 years, and they offered it at no charge. And I thought, why not? But I'm at the end of that 4-year little stint, and now I'm like, oh my God, why did I do it? So we're going to look at Asian harmonics, which most of you guys know as Chinese medicine or traditional Chinese medicine, but it is much bigger than that. So I called it Asian harmonics. They're trying to get away from using the word Asian or the word Chinese or the word Korean. So they're kind of trying on Eastern medicine right now. You know, and of course we all have to adjust to what is considered more politically correct. My background is in many different modalities, and the school I teach at is actually founded by a foundation from Korea. So we learn a lot of different techniques. And that's been really interesting to then integrate into my veterinary practice, where since 1992, I've been doing Chinese medicine on animals. Okay, so once we get the PowerPoint up, we're gonna get going. Do you like our animals? So we have lions and tigers and no bears. Oh my, what are we gonna do? But when we do the workshop tomorrow, we're going to actually utilize these particular animals, because I want you to take a 2-dimensional picture and be able to project it on a 3-dimensional stand-in, so that when you go home, you know how to find these acupuncture points. Okay, do we have a clicker? Okay. Well, I can just keep talking if you want. Awesome.
Thanks.
You betcha. Okay. 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 See, this is why I'm always the first speaker, because then we work out the bugs. And there's a lot of bugs when you're dealing with this much IT, and I really appreciate Jake doing it. Okay. Okay, so just a little bit about me, and you guys have my notes, okay? And you have a lot of notes. We're gonna go through some this morning, and then we're gonna finish them up during the workshop. So they're gonna be utilized for both. Also in your notes for the workshop, you have acupuncture point location on the dog, which is exactly the same on the cat, the same on the elephant, the same on the giraffe, both of which I've treated. I've treated a whale, okay? They're always the same because they're anatomical and the anatomy is similar. So we can always find these acupuncture points. That is something that I thought was so beautiful about the way that they talk about locating points, because they're based on anatomical landmarks that are going to be in every species. And then we may have some that are a certain distance from another acupuncture point. So again, you have my information. I can say click. It's this one.
It's that one. It should.
Or I'll just say click.
Yeah, you can say click.
Okay. So if you go to the next slide, Jake, we'll make it work. And I think the next slide is just our disclaimer. Again, you guys have it in your book, disclaimer basically. This is educational purposes only. And, you know, I'm not promoting any one thing, that it has a medical use, okay? In fact, here we're gonna talk about acupressure and the use of essential oils on those acupressure points, and then also stones. And the way that I designed the lecture is basically, we are looking at how would you choose it instead of exactly which one, okay? We have to get away from exactly which one. In fact, the best way to choose an essential oil is just to kind of shut up and be present with the oil. Because as long as it's a biologically active essential oil, guess what? It's going to tell you what to do, because it's had thousands. But what would change if I suppressed that fever over and over again? That's what we're talking about with this medicine. And then we have, from the classics, things that were written down after they proved effective for 250 years. They would write them down, because it took a lot to write things down 4,000 years ago, right? So they had to be proven before they even wrote them down. Now, do we have other things that are modern that have been proven for 250 years? We don't. We use a different way of proving. It's called evidence-based medicine, not right or wrong. But the classics are where we're taking these different pattern categories from. We have 8 pillars. We have the balance of qi, blood, and fluids. We have the sanjiao. We have the zongfu. We have the 3 treasures. We have the 6 stages, which is also known as the shanhenlun. We have the 4 levels, or the one bing. We have the 5 elements, the channel theory. We have the sama. We have the sansei. We have the master tongue. We have the traditional Korean medicine, the Japanese style, et cetera, et cetera, et cetera. I'm not doing all those today, okay? So the ones that are highlighted, we're gonna touch on. So this is how to find the disharmony. And then when you find the disharmony, in the definition of the disharmony, you know what to do. So if I say, oh, you have heat, what am I gonna do to balance the heat? Cool, okay? You have a deficiency, what am I gonna do? I'm gonna tonify, I'm gonna give you something, I'm gonna reinforce you. Or you have an excess, okay? What am I gonna do? I'm gonna try to drain that excess, get rid of it. Chinese medicine is exquisitely simple, yet complicated, because there's so many different ways to look at the puzzle pieces. And that's really all this is. So there's different methods. Each of them have their own rules, and you don't want to often overlap them, because they're not going to support you. So as I said, excess, deficiency, heat or cold, what substance is out of balance, where, we're going to talk about the jiaos, okay? So where in the body is the disharmony located? And then which pattern of recognition are we going to use to find the harmony? And I have lots of notes for you guys, as far as, if you think it's this, then use this, okay? And that's for the workshop. What I want you to get is, how do you find out what the disharmony is, okay? And hopefully I've simplified it. So these are the 8 pillars. So we're going to look at, is it excess or deficient? So excess is my son and his fever. That's an excess pattern. He has no deficiency when it comes to his, what we call wei qi, his immune system fighting against the external pathogen. He blows that thing out really fast. That's an excess. It's also an exterior pattern, okay? And in his case, there is some sort of pathogen that he's creating a fever to move through. It doesn't mean it's a wind cold, okay? But if we had an external pathogen that was cold, wouldn't it make sense for the body to create heat? And again, you can also eliminate heat with heat. You just use more of it, right? Okay, so exterior, it's going to be acute versus chronic. It's going to be on the surface versus more internal. It's going to be in the skin and the muscles and the channels. So instead of the organs, the bone, or a deficiency or a change in the chi or the blood. It's going to be a superficial pulse. And I'm going to show you where to take the pulses on animals. So there's 3 layers to our pulse. Way up here, kind of middle, moderate, and then really deep. Okay? So if you're feeling the pulse, here's your pulse. And you push on it, and the pulse is right there before you barely even touch it. That's superficial. The tongue is going to have a thick, sticky coat. The pulse is going to be flooding and full. So there's another way to feel the pulse. If the pulse fills the pad of your fingers, that's full. If it feels like a little thread in there and you're kind of like, is it there? Like this little tiny thread? It's going to be an empty pulse. Okay? If the pulse, you can feel it at all levels. Okay? It's full. It's vibrant. It's got stuff in it, right? If you kind of feel it and then it goes away, well, that's an empty pulse. There's nothing in there. So that's a deficiency versus an excess. So in your pulse, is it superficial or deep? Is it fast or slow? Is it full or empty? You know what you're dealing with. Now we just have to look at location. And then yin and yang. So a yang disease versus a yin disease. A yang disease is going to be exterior, acute, sudden, excess. And a yin disease is going to be interior, chronic, deficient, and cold-ish. Not always. But I'm trying to give you guys a simple way of applying your acupressure, which will be very effective. Okay? So during the workshop, I'm going to show you where to check. And then again, what does it mean? We've gone through that. So in people, our pulse is here. So it's right here. Okay? So right now, if you guys feel there's a little bump on your wrist here, put your middle finger there, and then roll your fingers to the inside and pull your pulse towards the outside, and your pulse will be right there. If you don't have a pulse, go to the back of the room. Anna will take care of you. So in animals, the pulse is in the inguinal area. So you're going to feel right here. Okay? And it's upside down because this pulse, the proximal pulse right here, is always towards the heart. So when I'm feeling people, I know to do these fingers, and it goes in that order. When I do animals, I have to reverse it. Now, you don't have to worry about first and second and third position. I'm not going to teach you the Sun, the Guan, and the Zhi, okay? What you have to worry about is what? Is it superficial or deep? Is it fast or slow? Is it full or empty? That's it. That's all you need to know. Don't tell my school. Okay, on the tongue, we have different regions on the tongue. And I'm going to talk about where is it located, but I'm going to do it by what we call the san jiao, the jiaos. So you have your upper jiao, which includes your lung and your heart. You have your middle jiao, and then you have your lower jiao expressed on the tongue. So you don't have to worry about the organ systems that are there, just the jiao, okay? So then you know where the disharmony is. So if you see massive red here, like this tongue, there's going to be heat in the upper jiao. So the tongue's going to tell you where it is. Okay, the pulse and the colors on the tongue, okay, are going to tell you what it is. So now we know we have heat in the upper jowl. And that's good enough for you guys to do your acupressure. So on sand jowl differentiation, it's one of the newer styles actually. It has to do with heat patterns normally. But what we find is that there's a lot more to the sand jowl than how they differentiate it with just heat. Because it also represents the different qi and blood and jing. Okay, so blood is the yin, the material, the matter. It is a three-dimensional holographic projection of the quantum field, which is what we really are.